We will go ahead and call our Insurance Committee meeting this December 17th, Benefits Insurance Committee meeting into order. I must read this, our opening statement and the electronic meeting determination. This meeting of the Benefits Insurance Committee is being conducted electronically pursuant to Governor Bill Lee's Executive Order 16. I would ask for a motion that conducting the meeting electronically is necessary to protect the public health, safety, and welfare in light of the coronavirus. Is there a motion?
So moved, Mr. Chairman.
I have a motion from Speaker Pro Tem. Is there a second?
Second for Mary.
I have a second for Mary. If you would, please call the roll. Madam Clerk.
Preble Acton. Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Happy to be here.
Holly Deering.
Was that a yes? Good to be here. That was yes.
Yes.
Okay.
Holly Deering. Alan Farley. Alan Farley. Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yeah, I'm glad to be here too, and that's a yes from me as well.
Thank you. We have a quorum.
Well, that was a motion to conduct the meeting electronically, so I'm going to dispense with the roll call. So we'll just move on. Sounds like we do have a quorum. We'll move into next is the approval of the minutes from the November meeting. Is there a motion to accept the minutes from the November meeting?
Motion to approve, and this is Mary.
Barry, she's made the motion to approve the minutes.
Second.
And a second. Any additions or deletions? Hearing or seeing none, please call the roll, Ms. Thompson.
Preble Acton. Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering. Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Alan McAdoo. Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Motion passes to accept the minutes from the November meeting. Next, we have the item number 2 on agenda, members, is our financials from Mr. Elam, Director of Insurance and Risk Management. Mr. Elam, you're recognized.
Yes, sir. On the 260 fund tracker, when you look at the calendar year for the month of, and calendar and fiscal year for the month of November, you have in revenue $7,360,701. In expenditures, you have $9,082,937, and the difference is a negative $1,722,236. Enrollments for the month of November is 6,277. The calendar year to date is $75,174,372 in revenue. The expenditures is $77,411,101, and the negative difference is $2,236,730. For the fiscal year, the totals, year-to-date, $26,867,419 in revenue, $37,227,869 in expenditures, with a negative difference of $10,360,451. That's the 264 fund. In the 266 fund, you can see November's a little bit higher than what it was this time last year. Moving over to its tracker, for the month of November, you will see that in 2020, there was $89,218.74 in claims. And for this time last year was $39,251.26. I'll break that down. The workers' comp for November was, of the $89,000, was $4,170.05. The OJI part was $85,212.59. And that concludes my report, Mr. Chairman.
Thank you, Director Elam. Is there a motion to accept the report?
Move to approve the report.
I have a motion to approve the report. Is there a second?
Second, Ms. Lois.
Second from Ms. Miller. Any additions or deletions? Seeing none, call the roll.
Rhonda Allen.
Yes.
Dr. Andrea Anthony.
Yes.
Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
It's unanimous.
Motion carries. Next member, item number 3, our work comp OJI statistics. Mr. Good, Safety Director, you're recognized. Yes, sir.
In the month of November, we had a total of 10 injuries requiring medical attention. That brought the year-to-date total to 147. Of those, 106 are OSHA recordable, 61 were restricted days, 24 were lost time days, and 21 all others. On the next page of your report, you'll see where we had a total this year of 147. It compares to the 2 previous years of 252 last year, and in 2018, we had 247. Taking a look at the incurred dollars for this year to date, we're looking at $771,000 compared to last year of $475 and 2008 of $551,000 at this time. The injuries for the month of November, 7 of them were within the Board of Education, 3 were within the County General, and you can see how they break down there. The 3 in the County General were spread across the Sheriff Department and EMS. And that concludes my report, sir.
Oh, thank you. Are there any questions for Mr. Good?
I have a question, please, sir.
Yes.
Question, Dan, on if we've got 147 reported injuries in 2020, the cost is $771,000. Did we have something drastic happen to have there's, a difference in the report of injuries last year of 18 and 19, and their dollars were less?
First off, the incurred dollars is just an estimate. And we've looked at that, and I've done some research and contacted the Collins Company who actually does the estimates and the for us. And they, in the first part of the year, has done some refiguring from prior years, previous this year, and have readjusted a little bit on their estimates, and that's kind of added to that. So they've revised their way they're doing their estimates.
Okay, so for 2018 and 19, can I assume that those are set dollars that we have or know we are going to have to spend, and then, like you said, 2020 is going to be an estimate?
Yes, incurred dollars is just an estimate. If the case or the claim closes early, that'll be reduced. And then if it should go up, then of course they would increase that. But that's just an estimate right now of what we're this year as compared to the previous years.
Okay, thank you.
Did I answer the?
Yeah.
Yeah,
I want to make sure I got it understood.
Dan, this is Lois. I have a question too. I'm not sure I understood. So they've definitely provided you with incurred dollars for the current time period. Are you saying that they also readjusted from previous time periods and added those incurred dollars to this?
No. They've just looked at what they've had experience previously. They've done it and then looked at where they are, and if they needed to reevaluate the way they were doing their estimations, that's what they did. They looked at that. That's all they did. They didn't go back and readjust anything. They were just looking at what the dollars are, and if the costs have increased, they said, we're not reserving enough, we need to reserve a little bit more, and that's what they did.
Okay, thank you.
A couple of things I can point out here. The incurred dollars is not going to be apples to apples compared to last year based on their increase in what they look at claims. And let me point out something else while we're on that. The numbers that we looked at as far as the claims paid that I gave in the 266 fund, let me go back to that real quick. In the 266 fund, you see that we have a larger number than what we had last year. But when you look at the average over the last 5 years, we are down compared to what we were. Well, the 5-year average is like $310,000, and I think in the 266 fund report, it's like $310,000, and we're looking at for 2020 $296,000. So really, November 2019, when you see $180,331 in 2019, 2019 was just a really good year. Compared to the average over the last 5 years being 314. So we're running average of what it has been for the last 5 years. We would still like to do better, but we're at average.
Other questions or comments?
If I could just make a comment.
Yes, sir.
The way I look at this, what's happened in the past, the insurance carrier, has reevaluated that and said we probably didn't estimate enough, and they've adjusted their estimation scale so it's higher than it has been in the past. That's the reason for the spikes.
Yes, sir.
The number of dollars incurred is important because it comes right off our county's bottom line, actually. But what's really important for us to look at are the number of accidents, in essence, the incident rate that we have. As long as that is maintained or going down, incurred dollars over the long term will follow that trend. So dollars is a misnomer by some degree, simply because we need to be looking at accidents versus the dollars that we spend. If we can reduce accidents long term, we'll be reducing dollars. So what I look at here is the incidents that we have, and is that trend up or down? And that's also kind of confusing due to all of the employees that we've added. over the last few years, 5 years, 10 years. So that's also influencing all of this as well. I'd just like to compliment Ed and Dan and that whole department on the safety program that we have and the way they're administering that safety program. It's impressive when you talk about a county government. Don't get me wrong, Dan, we can do better, but it's impressive.
We can always do better, sir.
But it's impressive as to what we've done. And once again, the way I look at it, we don't look at dollars as much as we look at the accidents that we had and what are we doing to prevent those accidents from happening in the future. If we can do that, we'll not only bring accidents down, but dollars will follow.
Thank you, Commissioner. Thank you, Commissioner Phillips. I agree with everything that you've said, but I must add to it is that we have really worked at bringing a team of people together, and we have our maintenance department, and we have the maintenance department with the schools. We're even dealing with the again, Dr. Anthony and the Board of Ed with their principals, and so it's developed into a very strong partnership, in my opinion. And without everybody else outside of our department, we wouldn't be able to make the progress that we're making, for sure.
Other comments? Seeing none, is there a motion to accept his report?
Move to approve the report.
Have a motion to accept the work comp OJI report. Is there a second?
There's a second, Holly.
Holly made the second. Call the roll, Madam Clerk.
Rhonda Allen.
Yes.
Dr. Andrea Anthony. Dr. Andrea Anthony. Doug Bodery.
Yes.
Amber Brown.
Yes.
Shay Crowell.
Yes.
Holly Deering.
Yes.
Alan Farley.
Yes.
Mary Hickerson.
Yes.
Lois Miller.
Yes.
Jeff Phillips.
Yes.
Shantae Sherrill.
Yes.
Eric Tutobeni.
Yes.
Motion passes. Thank you.
Thank you very much, sir.
Next, members, is item number 4, the wellness update. Mr. Chapa, Cigna Wellness Coordinator.
Thank you very much. Can everyone hear me okay?
Yes, sir.
Thank you. All righty. So looking at our wellness report, so these will be the last round of numbers for this year. We'll start seeing the new numbers coming in January. So currently, the last ones that trickled in, annual physicals, we're sitting at about 1,904 versus 2,039 previously. Biometric screenings are at 2,080 versus 4,051. Health assessments, 562 versus 2,917. Mammograms, 1,007. Again, I contribute that to the quite a few events that we were able to get set up and do this year despite COVID. So 1,007 versus 980. OBGYN screenings, 1,639 versus 1,649. Colon cancer screens, 361 versus 337. Cervical cancer screens, 1,419 versus 1,401. Prostate exam screenings, 450 versus 394. Flu shots, 2,041. Again, we were able to set up and work with St. Thomas to get about 400 people through various different events, despite COVID, to do that as well, versus 2,320. And to date, for everyone that would have met their 3-point goal, you'd sit about 3,176 versus previous years of 5,124. We're really looking forward as we kind of transition into the new year and things like that. So one of the things we've been working really hard with the Cigna team and the St. Thomas team to focus on next year and the programming and how we're going to go about that. One really neat thing that we're getting off the ground right now is Michaela, the population health coordinator with St. Thomas, is going to be kicking off a wellness challenge, New Year, New You. The signups are currently running now. We sent out a communication at tail end of Monday to all county employees on the medical plan and county employees. That'll start January 11th, and it'll run 6 weeks. So it's a challenge focused on healthy habits, healthy eating, exercise, things like that. So that'll be ongoing. Also, the Cigna and the St. Thomas team are working really closely together to identify some programs and several opportunities as we get into next year to make getting the 3 points easier. So we're talking and we're putting the finishing touches right now on some annual physical events in coordination with the clinics. Those will be taking place in February. And then we're also looking at other opportunities for biometric screenings using the mobile units, however we're able to for that. So a lot of really exciting things and partnerships with St. Thomas coming in the near future. And that will conclude my report.
Okay, thank you, Mr. Chapa. Other comments, questions for him? All right, thank you. Next, we have the Midpoint Report. Ms. O'Neill, Clinic Director.
Good afternoon. Can everyone hear me?
Yes, we can. You're recognized.
Wonderful. I'm going to share my screen if that's all right.
Your screen's good.
Okay.
It's better than Chuck's. Chuck's hair was growing on that last one. It was kind of interesting to watch. Every time he moved his head, it'd grow and his ear would come off. And, you know, so your screen looks good.
Perfect. All righty. So this is our monthly report for November 2020. And to get into that, we'll start with some information on the actual visit analysis of what we've been seeing in the clinic. In November, we had 657 visits. Of that, 499 were unique members seen, and that means that it was an individual and it was distinct regardless of the number of visits or the locations at which they were seen at. 86 of those visits in November were nurse-only visits. You will see that, of course, in October, our numbers were significantly higher, but that kind of goes along with the 291 nurse visits we had for the flu shots, for those flu shot drive scenarios that Chuck was mentioning. So of those visits, 652 visits were at our New Salem location. 177, I'm sorry, I'm telling you October. 278 of those visits were at our New Salem location. 193 were at our Stewart's Creek location, and 186 were at the Walter Hill location. Of those 86 nurse visits, they are a combination of flu shot-only visits, biometric visits, lab-only visits, blood pressure checks, TB skin tests, and things along those lines. Just to keep in mind, they can have a flu shot or a biometric or any of those types of things in conjunction with a regular office visit. So this does not mean that we only gave 86 of those services. It just means that we gave 86 of those services independently with the nurses only. And this is the unique member type by health center. In November, we saw 91 children, 482 employees, and 84 spouses. Of the nurse visit, 14 of them were children, 60 were employees, 12 were spouses, and for an 86 total on that. For our appointment types, the majority of our types were for established patient visits, and that could be anything from a medication refill to a sick visit, anyone experiencing a just a problem they're following up on, anything like that. It just means that they are a patient we have seen before. Oops, sorry, let me go back. And our second largest group was actually our telemedicine visits and our virtual visits. So telehealth virtual visits are those that include video and audio versus a telephone only visit. And you'll see the majority of our visits include both the visual component and the telephone or audio component, depending. And then we also did 49 annual visits along with that, and 22 dietitian visits with our registered dietitian on site. 379 of our members had more than one visit in the month of November. Of that, 2 members had 5 visits. I did look into those. Those were people with some very specific need, which is why we saw them so many times in the month. The same was true for the members who had 4 visits. Several of those are COVID positive patients who need good follow-up while they're going through that time. And then 117 members had 2 to 3 visits. Mondays were the busiest day in the month of November, and there were 5 Mondays in November. Some of these numbers are just keep in mind the fact that all of the clinics were closed for the holiday on November 26th. And then on Friday, November 27th, Stewart Creek and Walter Hill were closed completely, while New Salem saw patients for a half a day. So we didn't close fully on that Black Friday, but we did close 2 of the clinics. So our members are definitely utilizing that virtual appointment option that I just talked about. Stewart Creek and Walter Hill still remain with the highest average of their visits with virtual utilization over New Salem. With that, I did a little bit of research and found out that just over 57% of our patients who are utilizing the virtual visits are doing so simply out of the convenience and choice. They're having their medication refills and doing their check-ins virtually, so they're taking advantage of that option and are appreciating that. The other, just under 43% are doing so because they have symptoms that we would ask them not to come into the clinic for, and that's also just a great option because now we're not exposing anyone, but we're still meeting their need. So that is kind of how those virtual visits are outlining with our clinics. Of the virtual visits at New Salem, 24% of them were virtual, 34.2% at Stewart's Creek were virtual, and 26.88% were virtual at Walter Hill. Here we have our referral summaries. New Salem has done 32 referrals. Stewart's Creek has done 27. Walter Hill has done 20 for a total of 79 referrals to specialty care. You'll see the majority of that is still going to our dietitian, with 23 of those referrals going to dietitian services. We'll move on to our financials. In November, we had 499 unique members for a total operating cost of $124,193. Our total employee count is 6,337 with a PEPM of $20. I will point out that I do know that you'll notice that October was significantly higher in cost, but there were 3 pay cycles in October versus the other months. So there was a significant difference there, mostly related to that. We will be bringing you some population health here, and that's part of what we're working on with our partnership there with Chuck and Cigna. We're identifying some areas that we can improve health for our patients, and then some ways to track that so that you can see how those are affecting the population. And so coming in the near future, we'll have some metrics here that will outline that a little bit better, and you'll be able to see some of those specifics. Our top diagnosis code for November was for essential hypertension, with just over 6% of the population having that. You will see, though, that the second highest, which is exciting to see, is that adult health examination, which is that annual visit for those wellness programs, and the third being for the administration of our influenza vaccine. So again, a wellness-based code. So it's nice to see those in the top 5 there. I know that last month we talked a little bit about anxiety and depressive disorders. We have grouped those together just to make it a little bit more readable and make more sense. So this includes all of those diagnoses at that 3.17%. In November, 72% of the member visits were female, and in the age range of 53 to 62 of both female and male was the highest population base that we saw. Second to that, of course, was that 43 to 52 range of age, which was just barely within the difference there. In November for BMI, the female member population actually was in the normal range, so we like to see that. So that being said, this is people who come into the clinic. It is not necessarily indicative of the population as a whole, but it was nice to see that those in the normal range were the highest visitors to our clinics this month. And that the November male population, theirs was in the 30 to 34.9 range, which was the obese class 1. Again, we have multiple members, though, being referred to the dietitian to help with some of those BMI issues, with 22 dietitian visits in November and an additional 23 dietitian referrals in November. And that's all that I have to report on today.
Thank you, Ms. O'Neill. Any questions for her? Seeing none. All right. Item number 6, update medical, dental, vision, pharmacy, and stop-loss bids. Director Elam.
Yes, sir. I just wanted to point out that we did receive bids, 5 on the medical, dental, vision, pharmacy, and stop-loss, Cigna, Blue Cross Blue Shield, Humana, Aetna, Lucent, and then we got a bid on the dental only from Delta Dental. After speaking with Mayor Ketron, there was a committee put together, Mayor Ketron, Lisa Nolan, Doug Bodery, Commissioner Wayne Blair, Mary Hickerson, Lois Miller, and Sonia Stevenson, and we were in the process. We have met once with the information. We're still trying to get a few questions answered, and we will meet again. But to give you the timeline for the committee, we will be coming to the committee January the 28th to the insurance committee. Hopefully they will have a recommendation for this body. February the 3rd, we go to purchasing. February the 4th, we go to budget. February the 11th, we go to the county commission. Then after that, and after that decision is made on the carrier, or who's going to handle our claims and stuff, after that, we will be coming back to the committee in March. March 25th, we'll come to the committee with rates and different suggestions on trying to do everything we can to keep our rates where they need to be in comparison to state and other plans.
Okay, good report. Look forward to seeing those rates. Is there any other business to come before us today? Any other business? Seeing none, view us in tonight. We've got a full commission meeting. It's going to be a long one. Merry Christmas. Absolutely. Merry Christmas to all of you if we don't see you again. I hope you stay safe and
well.
And well. Absolutely. That's
Stay
important.
well.
We don't want to see your name come through this office, right? So thank you so much. But we're here for you. Merry Christmas, and we'll stand adjourned without any other questions, without objection.